Good afternoon, my name is Armando Martin, and today we are going to show you the physical assessment of the lymphatic system. We have to begin with the observation of the skin, because the color of the skin is related with some disease of the lymphatic system. We are going to explore looking for occipital nodules. We have to explore with the second, third, and fourth fingers in a circular motion, trying to looking for masses, tenderness, pain. It would be in a circular motion. After the occipital, let's continue with the preauricular ganglion. It's located in the anterior region of the auricular pavilion. We have to explore with two fingers in a circular motions, looking for tenderness, pains or nodules. Then we can continue with the posterior nodules, that it's located in the posterior part of the auricular pavilion, and we have to look for nodules and tenderness or pain. Continue with the superficial anterior cervical anterior chain, and it's located anterior to the sternocleidomastoid muscle, and we have to search in the same way that as I mentioned before. Then we can continue with the submandibular ganglions, and we have to search in the submandibular regions, and we have to explore below the chin, looking for nodules, tenderness, and this assessment could be performed in front of the patients or behind the patients. If we use our both hands, we can explore this region and this region with the other hands in behind the patient. We can continue with the supraclavicular, and we will begin with the upper part, searching, looking for ganglions in the supraclavicular regions, especially in the left supraclavicular region. That there is a ganglion that is named Virchow ganglion, that it's present when there are some neoplastic lesions in the thorax or in the abdomen. Then we can continue exploring the axillary ganglion. The axillary ganglion, and it should be performed in both parts, but we order the patient, we ask the patient to put their hands in the head, and we explore the region, looking for superficially and more deeper, trying to find any mass of tenderness. You feel hurt? No? That's normal. Then we can continue exploring the epitrochlear ganglion, that it's located in the at the level of the epitrochlear regions, and it's normal. With the inguinal region, and for perform this assessment, we can do it with the patient in a stand position or in a lying position. We are going to put the patient in a lying position. We have to explore looking for mass. First, we have to explore visually if there are any increase in volume, and after that we have to explore the inguinal region, looking for any mass, tenderness, or pain. We begin superficially and then continue more deeper. Then we can go to the popliteal region and explore in the popliteal area, looking for mass, nodules, tenderness. As part of the lymphatic system assessment, we have to include the assessment of the skin, and we have to look for edema. Edema with the characteristic of the lymphatic edema. We are looking for edema in the extremity. It's important to know if the edema is unilateral or if it is bilateral. We found, especially in women, edema in the mammary areas that are related with the obstruction of the lymphatic system when there are malignant disease of the breast. We have to explore the spleen. As the spleen is located in the abdomen, we are going to follow the steps as must be followed when we examine the abdomen. The first thing that we are going to do is auscultate the abdomen, specifically the spleen, looking for fluid and murmurs. What is expected is that there are no fluid or murmurs. Next, we have to palpate the spleen. What we are looking is for enlargement of the spleen. Normally, the spleen shouldn't be palpated below the external costal border, the substernal costal border. We have to begin far of the spleen because if we begin the exploration near the spleen and the patient has a splenomegaly, we can miss it. And what is recommended is begin far the spleen, maintain our hands in a stable position, and ask the patient to take a deep breath. Take a deep breath. And we can change the hand position during the breath out of the patient. Take a deep breath. Take a deep breath. Take a deep breath. Okay. It's normal not found any mass touching our fingers. We continue with the percussion. Normally, it should not be percuted. It should not be dull. If we find dullness during percussion in the spleen area, it should mean that the spleen is enlarged. And in this way, we finish the physical assessment of the lymphatic system. My name is Armando Martin, and have a nice day.